I wanted to talk today to you about menopause. Menopause is something that will affect all women at some stage of their life. I often have my patients reach out to me because they are struggling to manage their symptoms or feel lonely in their journey. My name is Rizwana Yakub. I am a GP and also work as a specialty doctor within women's health. I would like to talk to you today about menopause. Now, menopausal symptoms can start way before you actually stop your periods and can start in your mid-40s, but typically happens at around the age of 50, 51. The symptoms of this can be quite varied and women can often struggle with the symptoms that they face. I often have patients reach out in desperation because they're struggling with managing their symptoms. Some of the typical symptoms that you can experience are hot flushes, night sweats, or what may also be called vasomotor symptoms. Now, hot flushes typically tend to start in the upper region of the body. You tend to feel real intense heat either in the chest or in the neck area and the head area, and this tends to spread across the arms and the upper body. It can feel completely unexpected. It could happen at any point in your day or in your night and catch you out, maybe in a queue, during an intense conversation, or just sitting and reading a book. Now, when the symptoms come on, they can feel very intense. You can also start to sweat with these symptoms, feel anxiety because of the heat that you're experiencing, and some women also describe the racing of the heart or palpitations. As you can imagine, depending on how often this is happening in your day or in your week, this can really be quite disruptive. Now, when my patients come to see me, I often discuss with them that management has different approaches. We would often start with the least invasive, so looking at lifestyle things. There are triggers for hot flushes. Common triggers, things such as spicy foods, caffeine, which we're all guilty of drinking too much of, and difficult or stressful situations. Now, these are just a few of the triggers, but there are other triggers that you may find in your own life that when you start to then note when the hot flushes come on, you may link them back to a specific trigger. In those scenarios, it's sometimes easier to avoid those triggers or to reduce how much you have of, say, caffeine or of the type of food that might bring on hot flushes. But in other scenarios where there's no known trigger, we can still look at solutions. Often I will suggest things such as having water nearby, the use of fans, either in the room that you work in or often use in the daytime or in your bedroom at night time, opening windows, having cold flannels nearby, even opening a fridge or a freezer if you're in your kitchen and a hot flush comes on. These are simple solutions but might make quite a big difference. Other things could be wearing thinner layers or less layers during the day and even during the night. Even things such as avoiding dark colours, which will absorb more heat. Now, some of the other things that we'll move on to is that where do we go if we've tried all those things and it hasn't helped? In that case, I would say to you to book in to see your GP, or you could come and see us here at Manchester Women's Health. You don't need to suffer alone. I have often had women in desperation, having suffered for years and felt that there's no solution and that actually they're alone in this journey. You really aren't. Menopause affects every woman at some point in their life, and we don't need to do this alone.